Blood Transfusion Part 3. This current video is about clinical manifestation of blood transfusion reactions and nursing care. Fever is the most common sign during a blood transfusion reaction. A rise in temperature is the sole symptom for febrile non-hemolytic transfusion reaction. It is a diagnosis of exclusion. If the patient develops fever with one or more symptoms of a systemic inflammatory response syndrome or SIDS, such as tachycardia, tachypnea, and abnormal white cell count, this is a transfusion-transmitted bacterial infection which requires urgent attention. Acute hemolytic transfusion reactions are characterized by symptoms of fever, accompanied with pain at the site of intravenous access, severe constricting chest pain, flank pain, tachycardia, hypertension, and hemoglobinemia, with subsequent hemoglobinuria and hyperbilirubinemia, which requires urgent attention. Minor allergic or urticarial reactions refer to urticaria in the absence of other symptoms. This can range from one lesion to widespread urticarial lesions. Anaphylactic reactions are life-threatening. Patients can present with sudden onset of flushing and hypertension, followed by hypotension, tachycardia, widespread edema, laryngeal edema, bronchospasm, shock, and sometimes gastrointestinal symptoms, such as abdominal cramping, nausea, vomiting, and diarrhea. These symptoms usually occur within minutes of starting the transfusion. This is a medical emergency, and patients will often require transfer to an intensive care unit. When a transfusion reaction is suspected, immediately discontinue the transfusion. The patient's vital signs should be monitored closely. The nurse should perform a clerical check by examining the blood product bag and labels and confirming the patient's identification. Contact the doctor for further instructions. Prime new intravenous tubing with normal saline and maintain intravenous access. Additional interventions can be initiated, such as inserting a urinary catheter to monitor urine output and sending a urine sample to the pathology lab, taking routine bloods along with a sample for cross-match. If severe reaction is suspected and transfusion is to be terminated, notify the blood bank and return the blood component and the tubing used for transfusion to the blood bank for further investigations. Report to incident reporting systems in case of acute hemolytic transfusion reactions. Human error can result in the transfusion of incorrect and incompatible blood products. To avoid this, the safe triangle check prior to any blood transfusion is essential. This is performed by two licensed nurses by the patient's bedside, where the information on the prescription chart, compatibility form, compatible label on the blood component, patient's wristband is verbally and visually identified and cross-checked. Automated technology for identity verification according to the organization may also be available and used. Verification of patient's identity in taking and labeling pre-transfusion blood samples are also important in achieving safe blood transfusion. In safeguarding patients against human error, rigorous pre-transfusion and patient identification checks must be instituted before blood transfusion. Also, closely monitoring a patient's change in condition during blood transfusion and prompt response can lead to a satisfactory result. You come to the end of clinical manifestation of blood transfusion reactions and nursing care video.